Our criminal justice system is currently our primary institution for people with mental illness in this country. That's a tragedy. That's a failure. I mean, of all the successes we've had, that's something our system is missing. We're also showing up too much in the ER. Mental illness among homelessness is epidemic, and we know the problems that we have in our schools. This is just a chart showing the rise in institutionalization. Currently, we have more people in prison incarcerated in this country with mental illness than we ever had at the height of institutionalization. Our suicide rate is a national problem. We're losing more people to suicide in the military than we're losing due to military action. I want to close with this. This is from an investment report from a company called TripleTree. They basically look at different industries and assess the risks and opportunities from an institutional investor standpoint. And what they said about behavioral health care is they said today the behavioral health care market sits at an important inflection point. While the demand for mental health and substance abuse services is reaching unprecedented highs, the supply of services and providers across the behavioral health continuum is neither sufficient nor optimally aligned with the broader care continuum to drive improved outcomes at lower costs. They're talking about us, right? The behavioral health care landscape has evolved into a fragmented and often chaotic web of providers and delivery models that take a myopic view of treating specific conditions rather than a holistic view of the individual, who frequently suffers from several comorbid physical and mental health conditions. So given these rapidly evolving market dynamics, TripleTree believes the behavioral health market represents a highly compelling investment opportunity for both strategic and private equity investors. So we see that and we think, oh, well, that does sound familiar. That's a real problem. From an investor standpoint, they say there's an opportunity, right? And I think we have to begin to shift our thinking to seizing those opportunities for our industry. And we see that. We see lots of little startup companies, that never would have touched behavioral health in years past, with a focus on behavioral health now. I mean, they are coming. They're interested in, what has historically been our business that nobody else has been interested in.